Burns. Toddlers often will have hot water scald burns. They either pull water over on themselves or step into a tub that's way too hot. Older children, usually it's flame-related burns. Burns occasionally are a form of child abuse. And then children playing with matches or lighters are often a cause of burns. And children playing with matches account for 1 out of 10 house fires. Now, characteristics of burn injuries. The extent of the burn is described as the total body surface area. For this, you want to use age-related charts. I think in med-surg you're learning the rule of nines. The rule of nines doesn't work on kids because their bodies are shaped differently. The different areas are not equivalent to what they are on adults. But they're staged the same way. First degree burn is a superficial one. Second degree, you have partial thickness. So you've broken through the skin, but just broken through. Third degree, full thickness. So you've lost the dermis and the epidermis. You can then have a fourth degree, which is full thickness plus underlying tissue has been damaged. And this is where, you know, you're really seeing muscle, ligament, bone down underneath there. Here's how to estimate burns for infants and for children, and again, it's not the rule of nines because their bodies are shaped differently. Inhalation injuries. Trauma. This is trauma after inhaling heated gases or the fumes from toxic chemicals, or fumes that were produced during combustion. So when something caught on fire, you inhaled those fumes. Heat damage below the vocal cords is rare. Usually this is going to be the mouth and the upper trachea. However, upper airway obstruction, that can be very serious. So this still may require endotracheal intubation. Okay, pathophysiology of thermal injuries. You do get a systemic response that makes your capillaries more permeable. So you get leaky capillaries, which means fluid leaks out. You can also have, as you get those leaky capillaries, some bigger things that aren't supposed to leak out, such as the proteins, that albumin, and now you're going to pull fluid out because the albumin that has that oncotic pull into the vessels has moved out of the vessels. So keeping edema as well as circulating blood volume adequate is really important, and that's particularly during those first 24 hours or so, because that increased capillary permeability causes edema. You take that fluid out of the vessels. Now you have decreased intravascular volume, which can lead to decreased cardiac output and hypovolemic shock. You also get anemia, partly from damaging those cells during the injury, and then during kind of the whole changes of the capillaries, you damage some cells, some of your red cells, and you end up with anemia. Complications of burns. This is kind of during the immediate time. Immediately we want to do those ABCs, make sure the airway is okay, that they are breathing. Then we're worried about fluid and circulating volumes, so we want to avoid that profound shock that can happen. And then we're worried about infection, both at the local area where the burn is and systemically, because it's easy for something to go systemic once it gets under the skin and the skin is gone. Then we're also worried about inhalation injuries, aspiration. They can develop pulmonary edema, remember those leaky capillaries, and pulmonary embolus. So therapeutic management of burns during that immediate they're on fire stage, we want to stop the burning. My kids I know in school were taught stop, drop, and roll. We want to smother the burns. Kids typically, if they're on fire, their instinct is to run, The running just gives more oxygen to the fire. So don't fan it, don't let them run, but smother it out. And then we want to assess the victim's condition. Again, those ABCs first, their airway, their breathing, their circulation. Then we want to cover the burn, prevent contamination from getting in there because infection's a big problem, and then get them to the appropriate level of health care that they need and provide them reassurance throughout this. And continuing on, our first priority is always going to be maintaining an airway so that they can breathe. Next, it's going to be that fluid replacement. Keeping enough volume circulating during that first 24 hours is hard. Nutrition is a big problem in burns. They have an increased metabolic demand in order to make this new tissue. They usually are high calorie, high protein diet. And medications. They're going to need antibiotics for infection, analgesics, anesthetics for painful procedures, and leading to painful procedures is how to care for these burns. Minor burns, we want to keep the area clean. Debridement, we've got to get off dead skin for that new healthy granulation tissue to develop. But do you take off blisters? Usually not. Usually leaving a blister on to protect from infection is the better idea. If this is beyond blisters, this is a deeper wound than that, then we probably have a dressing on it. Your book talks quite a bit about different types of dressing, different antimicrobial ointments that can be used, and when you might use which. But it's not a simple choice of what is the best to use. Sunburns. We have both ultraviolet A and B waves that come from our sun. Ultraviolet A, they help to age our skin, and ultraviolet B, those are the ones that really give us sunburn. Now having sunburn as a kid is what predisposes those of us with light and fair skin to getting melanomas and other precancerous areas on our skin later in life. So it's really important to protect from sunburn. Hats so that you have shade on your face, light clothing so you're not hot but the skin, your skin's not directly exposed to the sun, and using sunscreen. Sunscreen is not recommended for children under 6 months, however, which means children under 6 months, we need to keep them out of the sun. They're, not really mobile yet until, maybe some towards the end of 6 months are rolling enough that they can roll out of our shade umbrella. But usually we can put up an umbrella and a blanket down and keep these kids out of the sun. And that will be better for their skin.